Welcome to YARKUD International. Let's prepare for Saudi Prometric exam. Let's see the question and answer one by one. First question, a physician has ordered gavage feeding every 4 hours for the 12 weeks old infant with a failure to thrive. In order to know how far to insert the feeding tube, the nurse should measure the distance from. Okay. So gavage feeding means it is the nasogastric tube feeding. Okay. So how the nurse will be measured for the 12 weeks old infant, they are asking. Okay. So here are the options. The infant mouth to the sebae process of the sternum, the tip of the infant nose to the ear and then to the umbilicus, the infant mouth to the ear and then to the umbilicus. You carefully read and the tip of the, because every options are just, they just take away the sum of the points only. Okay. So the last option, the tip of the infant nose to the ear and then the zooboid process of the stem. Okay. So usually we will be doing which is the measurement of inch tube, where from the where we will take, it is from the nose tip to the ear, the tip of the ear. Then nose tip to the ear, then ear to the zygoid process. Got the point? This is the answer. So adult and the infant will do this same one. Okay. So what is the answer here? It is D. Okay. Able to answer. So answer is D, the tip of the infant nose to the ear, then to the zygoid process of the stem. Okay. So you have to read the options carefully because all will be just, they miss the ear or they miss the nose like that only. Okay. So read it carefully and answer. So let's see the next one. A patient exhibits clinical manifestation of pulmonary embolism. Arteries blood has, okay, that is the ABG level and the chest X-ray are order. Which of the following test is used to diagnose this condition? Okay, so they are just given the diagnosis, pulmonary embolism. Okay, they are asking, they just physician order the ABG and chest X-ray and all, which will be the diagnostic this condition, pulmonary embolism. Okay, here the computer tomography, okay, that is CT scan and magnetic resonance imaging, MRI, pulmonary angiography, and pulmonary function test. Okay, so as we know, pulmonary embolism means there is a blood clot. Okay, so it will be diagnosed by which one? Pulmonary embolism. Main diagnostic test is pulmonary angiography. Okay, so these are the key points. Write it down. Pulmonary embolism, main diagnostic test is pulmonary angiography only. We can find out the embolism. Okay, got the point? So let's see the next one. A female patient admitted for the abdominal pain, complaint of generalized pain, nausea, vomiting, and constipation. Nursing assessment finds temperature 38.6 degree Fahrenheit Celsius, heart rate 92, respiration 18, blood pressure level 130/68. The patient has reborn tenderness and abdominal rigidity in the past hour. Her pain has localized on the right side. The nurse suspect which is the condition. Okay, they have given all the signs and symptoms. They are asking what is the diagnosis. Okay, so that is the question here. So you have to be just read it carefully. So here are the options: intestinal obstruction, influenza, appendicitis, pyloric stenosis. So you have to be select which one will be that. Okay, so here we will see abdominal pain and generalized pain, nausea, vomiting. Okay, and constipation also is there. Okay, so there will be the fever also there. See, the temperature is 1 at 1.5 Fahrenheit. So that is fever also there. And the patient have reborn tenderness and abdominal rigidity. And right sided pain is located. So what will be the answer here? So always remember the signs and symptom of appendicitis you should know. Okay, that is the pain is located in the lower right quadrant and reborn tenderness will be there. And one more key point is McBurnell pain will be there from the umbilical to the lower part of the abdominal. There will be the pain. Okay, it will be getting worse and the patient complained of nausea and fever. Okay, tenderness and sensitive to touch that area. These are the important signs and symptoms of appendicitis. Okay, so this is here the answer is appendicitis. Got the point? Okay. Let's see the next one. When teaching the parent of neonate with the spina bifida technique to promote the bladder empty, the nurse reviews the technique in which firm gentle pressure is applied to the abdomen, press towards the symphysis pubis. The method is known as, okay, so spina bifida patient, okay, there will be the, if you see up the, where is the spina bifida? It's there in the spine, okay. Below that, there is no sensation, okay. They cannot pause the voluntarily urine or there is a passing stool, okay. So the bladder emptying will be teaching to the parents. So here, which method they are using? Firm and gentle pressure applied in the abdominal, and there is a towards the symphysis pool, so urine will be passed. So which is the technique is called? It is called which one? Follies as prophylactic, or the intermittent, or gradis. Okay. Here the answer is option A, gradis. Okay. The gradis maneuver is nothing but it is just helping you to pee. Okay. Helping you to urinate the baby. So here the primary benefit will be drain your bladdering. Okay. Drain your bladdering, but you should not do manually long term and up. Okay. It should be for the time we can just use apply the gentle pressure over the abdominal toward the symphysis fluid so that the child will be having the pressure, so they will be past the urine. Okay, got the point? So that is called grades method. Okay, so let's see the next one. Blood and urine analysis confirm diagnosis of salicylate overdose. The patient is treated with a gastric lavage. Which of the following position would be most appropriate for the patient, the client during this procedure? So they are asking the gastric lavage procedure. Which will be the procedure? There is a gastric lavage. So with the position of the patient will be lateral or Trendelenburg or supine or lithotomy. Okay, so you just see from the greater curvature, they will just put the tubing and the gastric content will be empty, okay, from the laser curvature. So it will be the best, the position is lateral position, okay, lateral. And if they specifically mention right or left, it is left side. Got the point? Left lateral decubitus position. That is a normal term, okay. They're asking only lateral option, okay, just select it up. But if they mention right side or left side like that, left side decubitus position, it will be perform the gastric lavage. Okay, got the point? So let's see the next one. Okay, here the answer is lateral. Okay, next question. A nurse is preparing to obtain the atrial blood gas, ABG, okay, specimen from the client and plan to perform the Allen test on the client. After explaining the procedure to the patient, what is the next step nurse need to do for performing the Allen test? Okay, so here the options are given. So here, just remember what is Allen's test. It is before the ABG, we just need to check the blood supply of the hand. Okay, we have the ulnar artery and radial artery. You just take the Allen test from the radial artery. So if you punch the artery, okay, so there will be any temporarily there is a injury or any in the radial artery, there should be ulnar artery should be flowing the blood supply to the hand. But if in case the ulnar artery also it is damaged before that, okay, you are not noticed, what will be happen? There is full blood supply of the hands will be inhibited. There is the chance of the ganglion forming. Okay, that's why we are just checking before ABG blood supply to the hand. Okay, so what is the procedure? See, there is a ulnar and radial artery. First thing we have to tell the patient to just to the, we just obstruct the blood flow. So to pressing the patient ulnar artery and the radial artery. Okay, both. Okay, just tell the patient to tight twist. Then we will just press it to the ulnar and the radial artery with the two fingers. Okay, then we will tell the patient to unclutch. Okay, see the third picture, unclutch. Okay, and we just take out the ulnar artery pressure. Just release the ulnar artery pressure. So if it is the hand within the 5 to 15 seconds, the hand should be flushed. Okay, that will be the blood supply should be shown. Okay, if it is that, it is good blood flow, negative Allen test. But if it is still, you are just taken the ulnar artery pressure, but still the blood supply not going to the hand. Hand is very white. Okay, it will be not going to the blood supply. It is called circulation problem in the ulnar artery, is not sufficiently giving the blood flow. Okay, that is positive Allen test. Got the point? So if you know the Allen test, if they asking any question from that, you can able to write it up. Okay, so here they are asking Allen test is, the nurse is going to do the Allen test. Okay, so what will be the step first? Ask the client to open and close the hand repeatedly. As the color of the extremity distal to the pressure point. Release pressure from the ulnar artery. Apply pressure over the ulnar and radial artery. Which one will be first? See here. We will be applying the pressure over the ulnar and radial artery. That is the first test. Okay. So here the answer is D. Got the point? So before ABG, what is the test called? Allen's test. Okay, to check the blood flow of the hands. Okay, got the point? These are the questions from the Saudi Promotric exam. So here the YARKUD International, we are giving the online training for all nursing examination like Promotric, SNB, MOH, PHA, HAD, OET, IELTS, and Oman Pearson View nursing examination.